Gout is a type of inflammatory arthritis that happens when levels of uric acid, a normal byproduct of metabolic reactions in your body, become too high. When levels of uric acid get so high that your body can't easily dissolve and excrete it via urine, uric acid starts to crystallize. Uric acid crystals deposit themselves in the joints where they cause severe inflammation. The big toe is a well-known site of gout attacks, but gout can strike many different joints throughout the body. Gout is one of the oldest recorded diseases, with accounts dating back to ancient Egypt. This incredibly painful arthritis affects millions of U.S. adults today just as it did in historic times, as described memorably by Dr. Thomas Sydenham in the 17th century. The victim goes to bed and sleeps in good health. About 2 o'clock in the morning he is awakened by a severe pain in the great toe, more rarely in the heel, ankle or instep. The pain, which was at first moderate, becomes more intense. So exquisite and lively meanwhile is the feeling of the part affected, that it cannot bear the weight of bedclothes nor the jar of a person walking in the room. Fortunately, today gout is one of the most treatable forms of arthritis. Some rheumatologists say it can be cured. But for too many patients with gout, the disease goes untreated or undertreated. In one recent study, for example, only 37% of people with gout were taking the uric acid-lowering medication allopurinol. Among gout patients with frequent flares, only half were taking it. Improperly treating gout can cause the disease to become more progressive. Over time, gout can begin to affect more joints throughout the body and cause problems like gout tophi and permanent bone damage. Find out more here about how gout develops, how gout progresses through different stages, and how to treat gout to prevent symptoms, lower uric acid levels, and prevent long-term gout complications. Stage 1. High uric acid levels. Also called asymptomatic hyperuricemia. In this beginning stage of gout, uric acid is building up in the blood and starting to form crystals around joints, most often in the foot. Uric acid is created when your body breaks down substances called purines, which are produced in your body and can also be found in certain foods and drinks. While eating high purine foods can contribute to high uric acid levels, many experts believe that the role of diet in the development of gout is overemphasized. Chronically high levels of uric acid happen when your kidneys aren't able to efficiently get rid of uric acid, which can happen for a number of reasons, including overweight, kidney disease, taking diuretics, drinking alcohol in excess, diabetes, underactive thyroid, genes, family history, eating a high purine diet. In this first stage of gout, the person has no joint pain, no red or swollen joints, just an elevated uric acid blood test, says Theodore R. Fields, MD, FACP, rheumatologist at the Hospital for Special Surgery in New York City. This is the time that the uric acid, or urate, crystals are collecting in the joints and can cause inflammation later on. But high uric acid isn't enough for a diagnosis of gout itself. Most people with hyperuricemia never develop clinical gout, says Alireza Maysami, MD, FACR, FACP, rheumatologist at the Henry Ford Health System in Michigan. Stage 2. Acute gout. At this point, that sudden, unexpected nighttime attack of gout symptoms might occur. This is when the person has pain, redness, and swelling of a joint, most commonly in the big toe, the foot, the ankle or the knee, but gout can start in other joints as well, says Dr. Fields. This is when the urate crystals are released into the joint fluid and cause an inflammatory reaction, bringing in many white blood cells and releasing inflammatory chemicals that cause the pain, redness, and swelling. If you think you're experiencing a gout attack, see your primary care doctor or a rheumatologist to begin treatment for the disease. It's important to see a doctor during a gout flare because your doctor may want to remove fluid from the affected joint and look at it under a microscope to check for the presence of uric acid crystals. Identifying uric acid crystals in joint fluid helps confirm a gout diagnosis. Stage 3. Intercritical gout. After a first gout flare, 75% of people will have a second within a year, but some people can go years before another attack, says Dr. Fields. The in-between stages, where a person has already had a gout flare but is presently not having any joint pain or swelling, he says. Almost all gout patients will go through this phase, since it is the nature of gout to have flares and then quiet down for a period of time before the next flare. Even though it may seem like nothing is happening, this is the point in which patients should begin long-term treatment. Lowering uric acid levels with medication can prevent future gout flares and long-term complications that go with them. Stage 4. Chronic gout. This stage is also called tophaceous gout, because the uric acid deposits can form nodules called tophi, often at the bunion point of the big toe or at the elbow. But tophi can form anywhere in the body. This stage is where a person can have some joint pain from gout just about all the time, Dr. Fields says. It usually takes many years of uncontrolled gout for someone to get into this stage. During this stage, progressive joint damage develops, so patients with gout should be treated before this starts happening. Treatment delays can make gout worse, Dr. Masami says.